Welcome to familydoctor.expert. Today we're going to talk about Polycystic Ovarian Syndrome, often called PCOS, and it's very common in the community. In fact, about 1 in 10 or even as high as 1 in 5 women have it. But interestingly, about 70% of women don't know they've actually got it. So what is this thing? Well, basically, in a proportion of women, the ovaries have cysts which get large but don't actually fully mature to make a fertile egg. And we're not sure exactly why it occurs, but it seems to be related either to high insulin levels or maybe high hormone levels, particularly the androgens. And the thing about it is it creates quite a lot of annoying symptoms for people. The main thing women complain of are menstrual irregularities, so that might be irregular periods or amenorrhea, which is no periods at all. The other thing that it can often do is cause hirsutism, which is hairiness, which women don't appreciate, but the high testosterone androgens causes that. It can cause acne. The other thing that it can be associated with is mood changes, so anxiety and depression. So that all sounds like not a lot of fun. The other thing it can do is mess around with your fertility. So even though there are a lot of these cysts, they don't actually mature fully, and so quite a proportion of women who are having fertility problems actually have polycystic ovarian syndrome. So how do you know if you've got it? What's the doctor going to do? Well, if you've got 2 out of 3 of the following things: either ultrasound findings, and if you've got more than 12 of these cysts in at least one of your ovaries, that's significant. Or if you've got the menstrual irregularities, or on the blood test, if you've got the high testosterone levels. So if you've got 2 out of 3 of those, the cysts on the ultrasound, the high hormones or the menstrual irregularities, it's a pretty high chance that you've got polycystic ovarian syndrome. So why do we care and what do we do about it? Well, first of all, it seems to be, it does run in families sometimes, but anyone can get it. If you're overweight, it is associated with obesity. So there's a number of non-medication things that you can do. Losing weight is good. Eating healthy is good. Doing lots of exercise is good. So these are all useful. Sometimes we use medication. The oral contraceptive pill is excellent at trying to get the periods more regular. There's a risk with polycystic ovarian syndrome of getting diabetes, high sugar in the blood. And so we like to check that, and in people who are at risk of getting that, we might start them on a medication called metformin. And this is one that we actually use in people who've got diabetes, but also people who've got sort of pre-diabetes, so it's very useful. If you've mainly got the hormone problems, the testosterone issues, spironolactone is an anti-androgen, so it can turn down those male hormones, so that's a good thing too. For women who have the fertility problems, this is usually done through a gynecologist or an endocrinologist. They might give you a medication called Clomifene, and this can help you have more normal eggs from the ovaries, so that can help with the infertility problem. So you can see that there are a few risks associated with PCOS. It's pretty common. If you think you might be having these sort of symptoms, lots of menstrual problems or hairiness, or it might be worth just going along to your doctor and getting that checked out. So anyway, I hope that there's some useful basic ideas about the problem. If you're having issues, go along to your GP, maybe even get referred to an endocrinologist or a gynecologist. So I wish you well from familydoctor.expert.